Hello, and thank you for tuning in today. I have decided to start doing some videos geared towards professional and medical personnel who work in senior living, like independent living, assisted living, memory care, enhanced living, nursing homes, and so on. Or maybe you work in a doctor's office or a dentist's office, or perhaps an adult day facility, rehab center, or whether you work with or have contact with seniors. If you're a family caregiver, you're still free to join us as well, and you'll get a lot out of this information and training also. If you, as a professional, have any topics or specific problems that you would like me to address, just type it in the comments below. But the reason I specifically want to educate home care aides, nurses, and social workers in care communities is because I know that you crave some good quality training with tips you can really use. I owned a home care agency for years, and I would interview and hire people from memory care units. And when we would ask them about the dementia-specific training that they had received, in most cases, they're not getting any training at all, or very limited training. And they don't have the proper education or skills to know how to deal with, manage, or help people with Alzheimer's or other dementias. When we would ask our interviewees about their training, they would say, I was taught how to pass meds, or maybe they had 1 or 2 hours of dementia training during an orientation, or they had state mandated training that was an hour or so every year, and outdated, by the way. Well, that's not good enough. That's not even a fraction good enough. We've got to do better. The patients deserve better, the families deserve better, and you, the healthcare worker, you deserve better. Type in the comments, I deserve better. Well, it's not your fault that you haven't had the tools or training to do a great job. And I truly believe that most people who work in this industry want to know how to do things better for their residents and to make their life and their job easier for those that they care for with cognitive decline. Communities need to step up. They need to seek out, and I know it's hard to find really great training, but now you found it. Tell your employers, I'll come and train all of you, and we will have so much fun. You won't even believe it. But I know that all of you professional caregivers, nurses, and social workers, I know you wish you could provide better care. And I know that you wish you had the answers for your families when they come to you and ask you how to handle a behavior or a situation. I know that in your head, you would admit that you have delayed care because you're not sure what you're walking into. Or maybe you've avoided a patient knowing or fearing they would get violent or sling a racial slur at you. That's normal. But if you had some really amazing training, all of these problems would go away, or at least you would know how to handle it. You need tools, scripts, techniques. You need easy to learn and easy to remember and easy to implement strategies. And I've got you. I have spent the last 15 years putting this all together for you, the professional, because you deserve it. Please take a moment and subscribe to our channel so that you'll receive our latest videos in your feed. And please, for God's sakes, tell your friends and colleagues about us. Today, I'm going to reveal 3 secret tips that you can use to help the people that you work for, and in turn, make your job easier and more rewarding. Ready? Tip 1, pain. In a little bit, I'll have a free guide for you on pain that you can download. Can you think of a time in your life when you were in a lot of pain? The kind of pain that you would do anything to get rid of it? When it hurts so bad, you can't do anything else but focus on that pain? Well, just imagine if you were in that amount of pain 24 hours a day, 7 days a week, and couldn't tell anyone that you were suffering. You just have to lay there and suffer. Tough shit. You can't verbalize or alert anyone that you are uncomfortable or in pain. You can't tell anyone or communicate what you need. Now, something that most healthcare professionals are not taught is that when a patient or a resident becomes combative, it's not because they're actually trying to harm you. They're not. They're not trying to hurt you. They are desperately trying to communicate to you that they are in pain, uncomfortable, or they need something. The more violent they are, the bigger their pain or problem. So step back and take a different look. Look at the violence or swatting or the slapping. They're not intentionally trying to hurt you. They're trying to communicate with you. Wow, is that powerful or what? Type powerful in the comments for me. So the patient can't verbalize or get their thoughts or feelings out, so it comes out in the only way they can communicate, through actions, physical actions. The harder they fight, the harder the time they're having, or the higher their pain. Wow, does that make sense? Yeah, good stuff, huh? Just imagine how much you'd learn if you took my 4-day course. Every day is filled with these mind-blowing realizations. The Certified Master Dementia Strategist course? Oh, man. All right, so let's talk about some of the warning signs that you can easily look for to determine if your patient or resident is in pain. So on the Pain Assessment in Advanced Dementia Scale, or Pain AD Scale Assessment tool that you can download off my website, there are 5 different categories that you will assess. I'm only going to talk about a couple of them for the sake of time, but one would be to observe their facial expressions. Is their face all scrunched up and tight and tense? That could definitely be a warning sign that this person is experiencing pain. Another one is their body language. Take a look at what their body is telling you. Are their knees pulled up? Are they in a fetal position? Are they pushing or pulling away, like striking out at you? Are their fists clenched? Or are they maybe grabbing or holding the blanket tightly or grasping the bed railings? This is a warning sign that your patient is in pain. Are they repeatedly calling out, "Help, help, help," or groaning or crying? This person is in distress. Nothing pisses me off more than when I hear a person down the hall yelling, "Help, help, help," and the nurses say, and I know you've heard this, "Oh, don't worry, they're fine." This person is not fine. They are having a problem, and ignoring this person is abuse, and it needs to stop immediately. Imagine spending your last days, weeks, or months yelling, begging for someone to hear your cries for help. It's time to get more in touch with the people that we serve. We need to look beyond the behaviors and look at the problem. What is the problem that they're experiencing? Why are they acting out the way they are? How can we help them? How can we listen better? I can show you in my course. I can easily teach you how to be the hero. So I hope that you go to my website, answersabout.alz.org. Check out the course list, print it out, take it to your boss. Tell them you want and need this training. And download the Pain Assessment in Advanced Dementia Scale tool, because I think you'll find it fascinating. The next tip, tip number 2, is getting a clearer understanding of the person with dementia's interpretation of their surroundings. Because to the person with dementia, in many cases, and I'm sure you've been around people who are exit seeking or they're asking to go home, when people have dementia, they don't recognize where they are. So to them, they're in a strange place. They don't understand where they are or why they are there. And this feeling of being lost or alone is frightening to them. As they look around and try to figure out where they are, and they don't recognize their environment, and everything and every person is a stranger. This can be very frightening to the person with dementia. And not only that, but when you think about how do people react when they're in a state of fear, often that can come out in a reactive way, like a behavior. So if we can somehow help them feel more comfortable in a strange environment, we can also reduce the chance of behaviors and reactions. Haha, does that make sense? So now this brings me to my last tip for today, and that is comforting. If you can master the art of comforting, you can help the person with dementia to get through almost anything. And while I can only provide you with a little guidance today, if you decide to take the Certified Master Dementia Strategist course, this is something that we discuss several times throughout the 4-day certification program. Most people with dementia are fearful. They feel abandoned. If we are successful in comforting them and making them feel safe, we have done our job. There are many ways to comfort someone, but one of the best ones is to listen and to ask questions. First, listen to their concerns and then acknowledge their feelings. Make sure you're looking into their eyes and using a gentle touch, maybe on their arm or their shoulder. And be sincere. Keep a big smile on your face and try to keep the interaction positive. If a person with dementia feels safe, you are much less likely to encounter behaviors. So again, if you are genuine and let that person feel your kindness, you will be able to turn the situation around much, much faster. All right, there you have the 3 secret tips for professionals in the senior care industry. Please let me know how you like the video in the comments. Get your free gift, the Pain Scale AD, at answersaboutalz.org. Subscribe, tell your friends and your boss. Oh, and I also have a Facebook group called Answers About Aging and Alzheimer's. Join us. I'll see you next time.